I am an ER nurse. Last night, I had to report a doctor who almost killed a patient. I've been an ER nurse for 12 years. In that time, I've seen everything from nail gun accidents to people who superglued their eyes shut. But last night was the first time I've ever had to directly intervene against one of our own doctors. Dr. Mercer transferred to our hospital 3 months ago with impressive credentials and an even more impressive ego. The kind of doctor who interrupts patients mid-sentence and refers to nurses as the help. The administration loves him because he processes patients quickly, but among the nursing staff, he's known for cutting corners. Last night, a 19-year-old girl came in with severe abdominal pain. Dr. Mercer glanced at her chart for maybe 15 seconds before declaring it was obviously appendicitis and ordering prep for surgery. Something felt off. The pain was on the wrong side, and her white blood cell count wasn't elevated like you typically see with appendicitis. When I mentioned this, Dr. Mercer barely looked up from his phone. Nurse Patterson, when you complete medical school, you can make diagnoses. Until then, prep her for surgery. I checked her chart again. There was no notation about a pregnancy test, which is standard protocol for any woman of childbearing age with abdominal pain. I discreetly ordered one while drawing blood for other tests. 20 minutes later, I was reviewing results when my heart dropped. She was 8 weeks pregnant with an ectopic pregnancy vest or fertilized egg growing in her fallopian tube. If it ruptured, she could bleed out in minutes. If Dr. Mercer had opened her up, looking for an appendix, precious time would have been wasted while she hemorrhaged internally. I pulled our charge nurse aside and showed her the results. She immediately called in Dr. Evans, another ER physician who was working the same shift when confronted with a pregnancy test. Results. Dr. Mercer's face flushed. I was getting to that, he snapped. Though the surgical team was already waiting, Dr. Evans took over the case, properly diagnosing the ectopic pregnancy and getting the patient to the correct surgical team. She's now stable and recovering. This morning, I had to write up a formal incident report. My hands shook as I documented Dr. Mercer's disregard for protocol and dismissal of my concerns. I know there will be blowback as doctors protect doctors, and reporting one isn't an easy career move. As I was finishing the ASPRO, Dr. Evans stopped by the nurse's station. That was good catch last night, Patterson, he said quietly. For what it's worth, you are not the first to report concerns about him. 3 hours later, I was called to administration. I expected a reprimand for overstepping. Instead, I found the chief of medicine, the head of nursing, and surprisingly, a woman I didn't recognize. This is Ms. Lowell from risk management. The chief of medicine explained. She'd like to hear exactly what happened last night and about any other concerns you might have regarding Dr. Mercer. Turns out I wasn't the first to report him as I was the 7th, but I was the first with clear documentation of a near miss that could have been fatal. I just finished a shift where no one called me to help once. Sometimes the hardest decisions are the ones where you know there will be consequences, but some consequences I'll say a teenager dying because I was too intimidated to speak up. Nah, I couldn't live with. Standing up to authority isn't about being a hero, it's about remembering who you are really there to protect.